Hi, hi everyone. Medso Sans Frontiers, also known as Doctors Without Borders, or with the acronym MSF, is a medical humanitarian organization that works in over 70 countries in the world. And we deliver medical services, and as we say, to the people who need it the most. My name is John Riaga, and I want to welcome all of you into this webinar today. In the next 1 hour, we want to look a little deeper into two countries where MSF works, and that is the country of Sudan and the Democratic Republic of Congo. And we have called this webinar the Forgotten Crisis. And we just want to expound and speak a little deeply about these two countries and why we refer to them as forgotten crises. And just to bring this out for everyone in this call, and even those in this call, to have a little bit more of an understanding when we speak as MSF and what we witness on the ground. On this call this morning, I have with us Natalia Torrent, who is the MSF Program Manager in North Kivu in the Democratic Republic of Congo. And I have Lisa Sil, who is the MSF Project Coordinator in a place called Nyala in Sudan. And together, the two of them are going to get us into this discussion, even as we seek to understand why we are calling these two countries forgotten crises as MSF. I will ask them one by one to introduce themselves so that you get to know who they are and what they do, even as we prepare to get into this discussion. Natalia, please go ahead.
Thank you, John. As you said, I'm the program manager for one of the MSF teams in the eastern part of Congo, in the area that we call the Kivus. I'm here managing teams across the province and as well emergency teams that we have to deploy in the last after the last events. I have been in the year almost. I've been here almost a year and a half, and voila, that's me. Happy to talk soon about this part of Congo.
Thank you very much, Natalia. Lisa.
Hi, everybody. Thank you so much, John. And yeah, lovely to see so many people here for this webinar. Yeah, my name's Lisa. I'm a medical doctor, but I'm currently working as project coordinator for one of our MSF projects in Nyala, which is the capital of South Darfur in Sudan. I have spent most of the past 9 months working in various locations around Sudan. I've been working with MSF, with Doctors Without Borders, for about 15 years in a number of different conflict zones and highly insecure contexts around the world. And I'm from Australia.
Thank you very much, Lisa and Natalia. And again, welcome everybody else on call. Just to let you know that the chat is open and available. In the course of this discussion, if you have a question that you may want to ask or anything that you may want to say, you can use the chat. Feel free to raise any issue, and then we will be able to respond even as we go. Natalia, starting with you in Kivu, in the Democratic Republic of Congo, briefly give us this context and why, in your opinion, or in the opinion of MSF, we are calling this a forgotten crisis.
Thank you, John. I think that for a lot of the audience, these last days, maybe Congo has come back on the screens, especially when it was related to the fall of one of the two main capitals, no, towns in this part of Congo, and somehow has brought back an interest on what's going on in the kibbutz. But unfortunately, we can say that the situation and the people of the kibbutz, they have been living in a permanent conflict with different degrees of intensity since the 90s, for almost more than 30 years. Especially everything started with the events that happening in Rwanda that actually were spilled in this part of the country. And since then, unfortunately, the people of the kibbutz haven't seen a day of let's say peace or a calm. No? Currently, the intensity, or currently what we're seeing, no, how we can characterize the conflict has started maybe 3 years ago, especially early 2022, with the resurgence of an armed group that is called M23. That suddenly, it's not a new group, it's a group that has appeared before. But what we saw is that they started again they started again their operations. And they started in a very particular place, which is the border with Rwanda and Uganda. And suddenly they have been increasing their gain of territory. Obviously, this increase of territory doesn't come without violence, doesn't come without humanitarian consequences, because what we have seen since that moment is that has been a lot of population moving out from the areas that they were taken by this group. So right now, the way we can characterize the conflict is that it's a conflict that has two main parties. One party, it's the M23, that right now, even though it has not been recognized by Rwanda, it seems to be backed up by Rwanda, as according to the group of experts that they're reporting to the Security Council. And this group is basically opposing the government of Congo, no, the army, the Congolese army. And the Congolese army has looked for alliances and has looked for support. And that's why this time of this crisis, or this moment of the crisis, we see that there is a lot of different actors, and especially there is international actors that they have put in the play. And these actors, as especially, for example, local actors, as the what we know and what we have been knowing in Congo, because probably the audience has been hearing that in the past there's a huge amount of armed groups present in this part of the Congo, that they were it's true that they were leading some ethnical roots, but as well the reason why they were present is what they were trying to protect the area that they were considering that they were theirs. So this coalition of armed groups, they rally besides the Congolese army towards a common enemy, which is the M23. So the issue here is that they have legitimized that groups, and as well they have give them resources. Together with them, it was a moment that the Congolese government, they request support to the East African Cooperation, and actually the East African Cooperation countries, they're sent troops in this part of Congo, Burundi, Kenya, South Sudan. And it was a moment that they were retrieving, but the Burundians, they kept a fit the country. And since early 24, actually was the South African cooperation as well that they start sending troops. So right now, and especially the landscape that we had on the whole 2024, it was a very classical conflict with two parties, two opponents, the M23, backed up by Rwanda, on the other side, the Congolese army with all these allies, the what we call the armed groups that they were renamed as the Patriots, together with this coalition of international armies that they were in place. So this has been the whole 24. We see that the M23, even though there were some diplomatic endeavors, especially to ensure some negotiation, that it was boosted, especially at the end of summer of 24, somehow pushed and broke by the United States, but having some African heads on that, especially the Luanda process, that it was between the Congo and Rwanda, trying to sit down and trying to arrange things. But as well, there was another process that it was starting earlier, that it was trying to see how the armed groups could be brought back, could be rehabilitated into and that was a process led by Nairobi, led by the former president Kenyatta. So even though we saw that there were some political and some kind of diplomatic venues, we saw during 24 that M23 was not stopping on gaining territory. And actually, since last year, what we saw, especially in the capital of the North Kivu, which is Goma, the capital was completely encircled since February 23. And at the early of this year, what we have saw, it's a complete shift on what we're seeing in 24. To start with, the Luanda process that it seems that could be giving main results end of December. Mid-December, we saw that the results, and we saw that there was not agreement. So actually was stalled or almost dead, the process. And since the beginning of January, we saw a big push from M23. First of all, Masisi, that it was encircled and being contested. Secondly, we saw that Minova fell, which is a city a little bit southern of Goma. Afterwards, we saw that Sake as well was taken, which is the city that is close by Goma. And suddenly, in a very few moments and very few days, Goma is encircled. There's combat in town, and Goma fell. 10 days afterwards, we saw that Bukavu as well fell. And right now, we are in a moment that there is a lot of things on stake, and there is a big change on the outline of the conflict. We saw, and what we are trying to understand is how the things may be evolving, and to see which would be the future of the Kivus. Obviously, when there is conflict, and obviously when all these things are happening, what we see is that the civilians, they are the ones having the major consequences on all this. And during all these years, we have seen major displacements in the North Kivu. The United Nations says that there is more than 4.5 million internal displaced population in the North Kivu province alone. And in that moment, that the majority of the people, they were concentrated around Goma, and Goma was sheltering around 750,000 people by the end of December, knowing that with the new targeted cities early January, we're counting 250,000 people more. They were around Goma, so we can estimate that by end of January there were around 1 million people around Goma, internal displaced population. Obviously, during the years of the conflict, we are facing a very weak health system in the country. They're not able to support the populations that they require, and they're not able even to run what we call the national programs, and especially the vaccination, the routine vaccination. So that's why we see a population that is very vulnerable towards epidemics that could be perfectly prevented. Especially when there are conflicts, what we see is that civilians are not spared from the consequence of those. Especially, we have seen since early 24 and before that the civilians being caught in the conduction of hostilities. We have seen that civilians have been injured, civilians has been dead, and while the combat has been happening in the different areas. And as well, Goma has not been an exception, but this has been kind of like the pattern that we have seen in many other cities, not only Goma, that has been giving a lot of highlights on that days. So this is in a nutshell a little bit how the outlook on Congo. The problem here, that's why I said a forgotten crisis, is like we have been already 30 years. Now the population has been like going through during 30 years of a permanent conflict. So we are in front of as well on a very traumatized population. And what we see in front of us, it doesn't look much better.
Thank you, Natalia, for a very elaborate context. And I want us to go to Lisa to give us another context for Nyala. And when we come back, we would really want to probably go deeper and understand, because for 30 years, MSF has been in DRC, and you speak about 1 million internally displaced people. And now with even expanded, inadequate health services and facilities, and now on top of that, there is now this violence, and people have to move. So that when I come back to you, maybe you give us that picture and what it means for MSF in terms of operations. What are we able to do? Are we not able to do? Even in that context, how do we evolve with the context as it keeps evolving? I mean, for the last 30 years, things have not been the same. There are steps that have been made, There are drawbacks as well in between. But for now, Lisa, if you could as well give us a context of where you are.
Sure, thanks, John. Yeah, so the conflict in Sudan has been raging since April 2023. So next month brings us to 2 years of conflict in this country. And to give a little bit of background about how this conflict started, the previous president, Bashir, he managed to, in some ways, unite many of the warring parties or the armed groups across the country. We have two main armed groups, the Rapid Support Forces and the Sudanese Armed Forces. They were all working together. And then actually the leaders of those two groups came together in 2019 to oust the president. So there was a coup at that time. The president fell. And what followed for Sudan was a period of hope. And people in Sudan now talk about that period with a lot of sadness about the hope that came following the fall of Bashir. And there was an attempt to transition to a civilian government. Unfortunately, the leaders of these two armed groups, the Rapid Support Forces and the Sudanese Armed Forces, were not able to share the power. They were not able to reach an agreement, and the civilian government collapsed. And these two men with their armies went to war against each other, and that war broke out very suddenly and very violently in April 2023. There's many things that have made this conflict interesting and incredibly horrific. One of them is that the center of the conflict has been Khartoum, which was the capital, and in the early days of the conflict, Khartoum fell and is now in ruins. And the conflict very rapidly spread across other parts of the country. We have seen no reduction and no abating to the level of violence that we're seeing here, and the conflict is continuing to rage and to wreak havoc across the country in extreme levels since that time. The consequences have been enormous, and we're now faced with a situation where almost half the population of the country is facing acute food insecurity. We have also seen a number of attempts being made by third parties to broker peace agreements or to facilitate peace talks between the warring factions, and none of these attempts have gone very far at all. There has been an unwillingness from both of these armed groups to come together and to talk and to reach any sort of agreement. And both of these warring factions are continuing along the line that they want control of the whole country. So peace talks have been, intermittent but unsuccessful so far. And in the meantime, the civilians are paying the cost.
Natalia, sorry about that. I want to just begin with you this second round, even as you give us that description. And again, just like in the DRC, MSF has been in Sudan for a very long time, and we are now marking 2 years since the war began. And somebody has asked from the chat, Atap Athwai, but what is how are the staff managing the situation? Because I'm looking at people go all out to ensure that we are providing medical services, and then suddenly there is war to add on to that. So how are we managing in terms of the staff that we have in Sudan?
Yeah, I think like in any conflict, it is an incredibly difficult space in which to work, and it certainly takes its toll on the staff that are working here, both international staff as well as the Sudanese staff that we are working with. There is, however, I have to say the staff that we have working here on the ground are amazingly resilient and really carry a very strong humanitarian spirit. Many of the people, the Sudanese colleagues that we are working with here, they're incredibly grateful to MSF for our presence here and for giving them the opportunity to actually help and to give something back to their community. And it is heartbreaking to see how these people who have been through so much, and when we talk about the people that have been displaced, the people that have been directly and indirectly affected by this violence, nobody has been spared in this conflict. All of our staff, all of our Sudanese colleagues, many of them have been displaced. Most of them have lost family members or lost contact with family members. And yet they come to work every day with a smile on their face and this attitude that they really want to do everything they can every single day to help their fellow Sudanese. And in addition, the international staff that we have working here have made a commitment to work in such a highly insecure setting, to work away from their families and away from their loved ones, and to bring humanitarian assistance to these people. So although it's an incredibly difficult place to work, and we are faced with the impacts of this war on a daily basis, we hear horrible stories, but the collaboration and the teamwork and the collegiality that we see between people here and the humanitarian spirit, it really gives me some hope.
Hope and when is the hope that is still keeping MSF in Sudan, that something is being done even in the middle of all the things that are going on. Natalia, we were speaking about how you are able to evolve from giving services in an IDP camp, and then the IDP camp itself is being dissolved and people have to move, and you have to move with these people because you know what they need in terms of medical services, and you go all the way, sometimes even to follow them, even as they move. Give us a picture of how this evolution of the entire thing, affects the work of MSF and how you are coping.
Thank you, John. As I said before, MSF has been present in the country for 30 years, and the main issues or main challenges that we have is that we are in a country that it has a very weak health system. So obviously, to be able to operate, we have to ensure that in some of the areas we reinforce the health system, and at the same time we are confronted for the fact that in this region and this area, there is constant epidemics that require reshuffling, requires flexibility, require rethinking of things. No? So we are kind of confronted with this dilemma, no? Because in one hand, we need an MSF. It's present in, especially in North Kivu, for example, we're managing 4 big hospitals, because if you want to ensure life-saving activities and knowing that the hospitals are not functioning, you have to put yourself into. So right now, MSF, we're managing 4 big health structures in the North Kivu. And at the same time, you have to have the flexibility to respond to cholera epidemics, to respond to population moves, as you were saying, John, to respond to any other thing that it may come up. No, so it's making our operational choices hard to do. No. Just for putting an example, no, what you were referring to, no, as I said in my introduction, around Goma, there were these internal displaced population camps all around Goma, and MSF, we were operational on those camps. We have been operational in those camps since 23, and the type of activities that we were managing were diverse, no, from very classical primary health care clinics, nutritional clinics, to more specialized care, as providing medical care to survivors of sexual violence, to providing as well specialized care to patients of cholera. We were providing wash. So it was a kind of a multitude of projects, no? And it's true that we have been investing all the 23, all the 24th, all the January as well, 25th. And obviously, when there was a moment, and especially when the fights they were coming closer to Goma, obviously some of the clinics will have to close them down, because obviously the combats were passing through actually the camps. And it was, in that moment, it was a kind of a tough call, because obviously we also have to ensure the well-being and the safety of our staff. So, but as much as we could, and especially thanks for the staff, because for example, some of the clinics, they were able to be operational because some of the staff, they were living very close or even on the displaced camps, and they were able to go and open. So we have, it was very interesting, because we had recorded consultations during the days of the heavy fighting in Goma. At the same time, in those days, and especially the way MSF sees, that's why for us it's very important to read the context and to see what it may happen. For example, the day before, or for example, the week before, we saw that the combats would be getting closer to Goma. And the fact, fact that we're already present to a hospital that it's called Quechero, but we're present with a pediatric care because we're taking care of kids with malnutrition and as well with infection diseases like the measles. We had to reshuffle our presence at the hospital, and especially because we're in contact with ICRC that they were managing a surgical hospital, a hospital with surgical capacity. What we agreed is like we will open some bed capacity to deal with the less serious patients. No, that way we would be ensuring that the hospital that it was managed by ICRC with surgical capacity would be not overflow with patients. So we create a kind of a referral system in between the two hospitals. So, and that was done to, the week that we saw that the likelihood of the combats approaching Goma maybe happened. So that's the way that MSF completely reshuffle and rethink the best way to operate and the best way to respond to the population needs. Combats passed through Goma. During a week, the majority of the projects we were in standby, except this hospital, with teams on the hospital grounds with very complex like in and outs, because obviously there were combats in town. When the situation got calmer, obviously what the first thing MSF teams that we were in the ground, because we were always staying put, even though we moved some not essential staff out, we managed to go back to the facilities, to go back to the clinics, to go back to the camps and restart those activities. But at the same time, we reassess new needs that could be appearing in that moment. And we basically work in two main lines. We work especially knowing that there could be a lot of injured people, how those injured people were being taken care of at the hospital. So the hospital capacity to do light surgery, follow-up of patients with injuries, and we established and we entered to a second hospital. We also reassess the situation of water in town, because Goma is a town that is prone to cholera epidemics, and we know that during the days of the heavy fighting, there was no electricity and there was no water. So we tried to reassess which was the water situation in town and start very quickly. For example, something very simple, no, that with the association, the water tracking association, we just gave them chlor to make sure that the water was chlorinated before reaching the houses. And since then, we try to retake what we were doing and plan new activities. Another activity that we put in place, especially in a context that you have a lot of injured, is like you have to ensure that you have a good blood bank. So we support the blood bank, the Goma blood bank, to increase the donations, ensure that all the hospitals they were well staffed with blood. The major problem that we had is that a week after we were able to reopen the activities on the camps, those camps that just disappear with contradictory information of official orders of the population to move out from the camps, rumors. So we said that from one day to another, all these 1,000 people, actually, they move out from the camps. And obviously, it put us a kind of a tough question. It's like, what do we do? So the first thing we try to do is to reassess where this population are settling, and starting, and some people that were settling in town. So we just add some of the services in the already structures that we were present, or trying to identify new structures where we could put some of the specialist services that we had on the camps. And we start as well to get out from Goma and trying to see where these people, they were kind of like going or settling. And since then, for example, we have clinics in the major hubs getting out from Goma, and we have been like coming from a mobile clinic type of very light response to identifying which is the center that we're going to be investing into. And since then, we're still monitoring. We're monitoring, for example, right now, we are trying to understand the cholera and how the cholera is going to be taking up, knowing that this area is endemic of cholera. We're trying to understand which is the follow-up of other diseases, like, for example, the measles. Right now, we are also being reported high numbers of malaria in population that they're going back to several villages. So right now, as always, MSF, we're trying to read the context through the humanitarian medical lenses and trying to readapt the operations that we have been like conducting in place in the kibbutz.
Yeah, thanks, Natalia. And I listened to both of you, and what is coming out, I just want to pick on this. You have spoken about tough choices choices. And I know both of you from where you sit as people who are responding to various kinds of humanitarian needs. And you know sometimes that you really need to be here, you really need to do this. But there comes a time that you have to make certain decisions that probably you do not like, but you have to make them anyway. We have the example of Sudan, where MSF, we have said we can no longer do this until this and this happens. I want you to speak to, both of you, just speak to very briefly, because I want to open this up to see if we have any questions that have come up. We are in the 35th minute or just past the half-hour mark. But I want you both to speak about the tough choices that as MSF, we have had to make, knowing very well we really need to be here to give services, but because of either safety of our staff or for whatever reason, we have to put this to a stop, and what that means to the team on the ground and the entire work that we do as a humanitarian organization. Maybe Lisa, you want to begin?
Yeah, sure. Very good question, John. And I think we are every day faced with these difficult choices. And I really echo what Natalia said about the needs changing and us having to constantly adapt and reprioritize and think about where should we be operating and how should we be operating and how can we do this and how can we get access to these populations. One of the really big challenges that we face working in Sudan, along with all of the other international organizations, is around access. And there is systematic blocking of humanitarian aid by both of the warring parties in this instance. So in order to provide humanitarian aid, we first have to spend a lot of our money and resources and time and human resources on fighting our way through this administrative barrier to being able to deliver aid. So that's one of the big challenges that we face. One of the other things that makes it extremely difficult to make these choices is that the needs here are just so overwhelming. And it's from day one, you come into this country, you come into this conflict, and you walk out on the streets and you start talking to people, and the needs are just huge and they are everywhere. We're looking at a country where, as I said, 1 in 2 people are facing acute food insecurity. We're in a country where 11.5 million people are internally displaced. So the needs are just so huge that it's difficult for us to make these choices, right? Like amongst a population where everybody is vulnerable and where everybody is affected, how do we choose where to intervene, who to intervene with, and who are the most vulnerable people, and how can we have the most impact that we have with the limited resources that we have available? And another point that makes things really difficult and forces us to make these tough choices is, of course, the security context that we're working in. We are working in active war zones. MSF is present in many of the hotspots of the violence and places where this war continues to rage, and we are surrounded by fighting. And in certain instances, humanitarian actors themselves are being attacked. And we have seen throughout the course of this conflict in Sudan so far, we have seen many, many counts of attacks on humanitarian actors and healthcare structures. I was previously working in Omdurman in East Sudan, and during the time that I was there, 2 of the hospitals that we were supporting were impacted by shelling. Since I've been here in Nyala, the main hospital that we're supporting here has also been impacted by aerial bombardment. So we are seeing a total disregard for international humanitarian law, which makes it really hard to say that we can ensure the safety and security of our teams, which is obviously very important for us in terms of being able to continue our work. And we have to make really difficult choices sometimes that we need to pull out of certain areas. We've just had to pull out of some of our activities in North Darfur. We've had to pull out of some of our activities in Khartoum State because the security situation became untenable and we could no longer guarantee the safety and security of our teams. And these instances are always difficult because we know that we are walking away from a situation where there are huge needs and that nobody else is able to step in and fill those needs. And so those populations are going to be in an even worse situation before and not having any access to healthcare.
Thanks. Natalia, you want something on that?
Well, the only thing I can do is echo what Lisa had just said, because what she has been recalling for Sudan, unfortunately, we're facing the same situation in Congo. From administrative barriers to be able to get access to population, to security constraints, and having to have tough decisions on between how ensure that the staff is in safety versus delivering the lack of respect as well of the medical mission, the humanitarian spaces that we have seen in several areas, and as well, I mean, and the other big impact and the other big challenge that we're seeing is the impact that is going to have on the reduction of humanitarian funds coming from the United States. Because in this part of Congo, actually, the larger donor for the response in Congo, that it was already falling short from the demands, was US. And right now we're trying to monitor how and which would be the impact in such a dire condition. In such a dire condition. And this is really worrying us, because if already we're seeing that the humanitarian response was going behind the needs, despite the majority of the humanitarians has been here since last 30 years. Right now, with the drainage of funding, the situation is going to get much worse, much worse.
Thank you, Natalia. Really, really tough choices there for us as MSF. There is, ladies and gentlemen, if you have a question, as we have said, question to Natalia. Somebody is asking about the situation at the Goma airport, having been closed for a while. How is MSF managing the issue of access and the airport and the issue of our supplies that you have?
Indeed, the airport has been closed since the 27th, 28th of January, when the combats were kind of pretty much closed in town, and has been closed since then. And we still don't know when it's going to be open. It's true that the airport were basically mainly used for moving stuff, and for moving a staff, not to get only into Goma, but as well to be able to deploy staff to the different projects, and as well to deploy supplies to the different projects. Because right now the main issue that we have with the closure of Goma, it's not from the international supplies, because we can have some other alternatives, especially by land on the neighboring countries, and as well we can also access to this part of the country through the neighboring countries. But the main issue that we have right now is how do we move from Goma to projects that right now they're lying on the government control area, for example, because we used to use the helicopters or planes due to the distance, due to the insecurity on the road, due to the logistical as well challenges. So right now the closure of the Goma project is basically hindering the internal rotation of staff, the internal as well supply to some of the projects that we cannot reach by road.
And so we've had the instances in Sudan. I know earlier you spoke about the blockade and you're not able to move. How are we doing in terms of the supplies and supplies in terms of medical equipment and even humanitarian aid workers who need to move from one place to the other in Sudan?
Yeah, in Sudan, this has been very challenging. It's been one of our big problems. It's again not only being something that MSF is facing, but something that all of the international NGOs and the UN agencies are dealing with, is how do we continue to bring supplies into Sudan, and particularly into Darfur, where I'm currently based. The only supply route that we have really available to us at the moment is coming through Chad. So we depend a lot on the Chadian authorities to give the right permissions for us to move cargo and to move people through, which so far they have been reasonably friendly with this. But we are then dependent on mainly one border crossing point between Chad and Darfur, the Adre border crossing. And this border crossing is periodically closed. It was closed last week for a short period of time. And it is periodically closed by the authorities. And even when it's open, there are quite severe limitations on what can be brought through. We have to go through a very strict process of applying for the right permissions, and a lot of the time the processes for application for these permissions is very opaque, and it's very it takes a long time. And quite often we have our cargo trucks or our movements carrying international staff arrive at the Adre border crossing thinking that we have all our paperwork in order, and then we're denied entry. Just in the past month, we had 3 cargo trucks carrying essential medical equipment that were stopped at the Adre border crossing and were held there for over 3 weeks whilst we worked on negotiating to get those supplies in. We are seeing the same thing happening with other organisations, and particularly in terms of food and the huge food needs for the population of Darfur. People here are starving. And because of the total breakdown of the social structure, because of the soaring inflation, because of the ongoing and repetitive displacement that people are facing, people's normal systems for producing their own food, procuring their own food have all fallen apart, and people have become very reliant on foreign assistance and on these food trucks coming in. And we are not seeing anywhere near enough food trucks coming in to Darfur to meet the needs of the population. The trucks that are being allowed through is a very, very small number compared to what we need to see. So the supply situation is dire. We're also about to come into the rainy season, and during the rainy season, a lot of the bridges are damaged, roads become impassable. What was already a difficult situation in terms of supply becomes even more challenging because of these other logistic constraints. And for example, in the last rainy season, MSF continued to operate here in Darfur, but we got ourselves a couple of boats because so many of these bridges had washed out, and we were needing to rely on boat transport to get our supplies in across these rivers. So we are looking at creative solutions, but really it's not enough, and the challenges are enormous.
Thank you. Thank you very much. But even as we move towards the end of the session, and there is a reason we call this webinar Forgotten Crisis. I just want to ask both of you, when we speak about forgotten crisis, who has forgotten the DRC? Who has forgotten Sudan? And what is it that needs to be done so that both Sudan and the DRCs, and indeed the other places, are taken seriously as crises that really need people to go deep and look at? Who wants to go first with that? Let's see, Natalia.
Natalia, go ahead.
Thank you, Lisa. I mean, who has forgotten DRC or Sudan? I mean, to start with, MSF and the humanitarians were just coming to put patches, and we're just coming, and we are in these places not with intention to resolve the crisis, because it's not us who's going to be resolving the crisis. We are here because population are suffering, and we are here because we have another human being suffering and passing a very tough time. And that's the reason why MSF, Lisa, myself, we are present where we are, because we know that we can bring this comfort to another human being who's going in a very tough moment. But we also have to be realistic that what we're putting is basically patches on this system. And obviously, this crisis or these countries are forgotten, and are forgotten by international community, because the solutions to all to everything that is happening in Sudan, in Congo, it's politicians, it's political will, it's somebody else than us who can bring a solution on the suffering of people. And what we are seeing, both what Lisa has been reporting from Sudan, what we're seeing from Congo, is that this political will is not existing. And political will internationally, political will nationally, and this we don't see that the system and the global system is ready, or has been being maybe willing, equipped, ready for tackling this crisis that has been ongoing since years. Because right now Sudan, it's a new step, but it's not the first time that Sudanese people are suffering, and it's not the first time that MSF were present there to comfort this population. As I said, Congo has been more than 30 years. This part of Congo has been more than 30 years in a permanent conflict with different intensities. So the question is not on us, and the question is basically why there is no political will to resolve these situations and stop, to allow the people not to suffer anymore.
Yeah.
Lisa?
Thanks, Natalia. Yeah, I agree very much. I also think that it's overwhelming for people, and I think people feel very powerless to do anything to help. And I think, as Natalia says, the DRC has been facing such problems for many, many years, and the same with Sudan. This is not the first time that Sudan has faced conflict in recent years. And I think there is a certain element of fatigue from the international community in hearing about these conflicts. What has been somewhat shocking in this current conflict in Sudan is the magnitude of the humanitarian needs here, which is unprecedented. And the displacement crisis that's happening in Sudan at the moment is the largest displacement crisis that we are currently seeing anywhere else in the world. And unfortunately, for whatever reason, sometimes these crises are overshadowed by other things that may be going on in the international space in the global community. And I think there is also an element of fatigue and helplessness. I think people see information coming maybe from Congo or coming from Sudan, and they think, I don't really know what to do to help. It's such a huge problem. I can't do anything. So we are also seeing challenges from the international NGOs, from non-government organizations because of this, because they rely on funding from individuals as well as from governments and from other agencies. But when people are not aware of these crises, or when people are not really, I guess, in a position to take on what it means, what these crises mean, it's difficult to secure the funding. And so we rely on the media, we rely on the international media, and for some reason we are not getting enough international media attention on either of these conflicts that are going on. So what we need to see a scaling up of the international humanitarian response. We need to see a massive scaling up on the part of the UN and the UN agencies to come into Sudan, because at the moment we don't have any UN here in Darfur. We're operating in a space where there are hardly any international organizations. The UN are notably absent in most cases. And we need a huge scale up, and that scale up needs to be facilitated not only by the international community, but also by the warring parties, who need to allow international organizations to come in and stop putting these barriers on humanitarian assistance.
Thank you very much for bringing that out clearly. We cannot do this alone as MSF. We need everybody else, as they say, all hands on deck. And that is why we are making this call today, that people need to remember that we have human beings in Sudan and DRC that require to live their lives like every other people in any other part of the world. There are two questions that I will ask. I think these go to Lisa. But Omar is asking, how do we meet the crisis, the challenges in Darfur and specifically in El Fasher? And then someone else is asking about the project in El Geneina at the Mornay Hospital. But what is the fate of the people in Mornay after the departure of MSF from West Darfur? Be very
Yeah, both very good and very relevant questions, and again somewhat difficult to answer. But I guess what I can say is that MSF is very committed to being here in Darfur. We're very committed to being here in Sudan, and to doing everything that we can to respond to the most urgent and pressing humanitarian needs that exist here. Obviously working within the constraints that we have already outlined. But we are committed to being here. We do also maintain a level of operational flexibility. So when we maybe see that the needs are increasing in one place, we have limited resources, unfortunately, and we cannot do everything as much as we would like to. We cannot respond to all of the needs of all of the people. One of the things that I have found, as I mentioned in the beginning, working here in Darfur, is that the needs are everywhere. every village, every city, every suburb, every neighborhood that you go into, and you sit down and you talk to these people, and they start telling you about what they've been through, and they start telling you about what the needs are. The needs are just so enormous. And we can't, unfortunately, be everywhere. So we do have to make decisions sometimes to pull out of certain areas where maybe the needs are slightly less, because we see a more pressing or more urgent need in another location. And that might be, as Natalia was mentioning before, a new outbreak of cholera. It might be a newly displaced population of people who have just fled the fighting from another area. So we do need to maintain that capacity to move and to be flexible. But we, of course, acknowledge that when we leave, we often do leave needs behind, and a lot of the time those needs are unmet. So it is difficult. I'm also looking at in terms of the human resources question. Yeah, there are gaps for sure. But what I will say, and I'll let Natalia speak to the DRC context, but what we see here in Sudan, as I mentioned, is that we have an amazing. We have so many staff who are very, very capable and very experienced and very willing to be here and to help out. So we are very lucky from that sense that we have a fantastic team and that we do have enough people to do the work. It's more about the challenges of getting international staff in, and the challenges of how we allocate those resources and how we respond. Over to you, Natalia.
Thanks, Lisa. Yes, on human resources, you know, we rely with local recruit staff as well with some internationals, because as well, I mean, so far has not been many impediments of bringing people in. The way we operate on MSF is that each of the mission we have what we call an emergency preparedness plan, and within the plan is already pre-identified staff to cover certain needs. So as MSF has been present in Congo for many years, we have these plans, and we have what we call pool de reserve, like a staff that has been already identified to be used in case of a specialized need, no? Cholera outbreaks, measles vaccination campaigns, etc. So we're trying to pull out from this list and being already ready to anticipate things. Now, Congo has been a mission that has been, unfortunately, we have been seeing emergencies coming in a recurrent way. So that's why, as a mission, we have to get ready for that. There were questions about evacuating staff and medevacs, what we call medevacs, and indeed, it's very challenging, especially in some of the areas that either the only way to evacuate staff is by road or either by air. And as I was explaining before, the main challenge that we have right now is that Goma cannot be the hub, Goma neither Bukavu, because both airports has been taken by the new administration, and we cannot use them to fly to government control areas. And this is bringing a huge headache, a huge challenging on mobility of staff, but as well to be able to ensure that there are medevacs available. What we are doing as well in MSF is like we make sure that all the staff that they're coming to the country or either going to be located in an area, they're aware of the personal risk taken for the fact that even though the organization would do everything possible to support in a kind of complex situation, we cannot. There's moments that we are incapable. So here it's clear that all of us who are working with MSF, either international, either national, there is an acknowledgement of the personal risk that we have to take for working with MSF and for the mission that we have been accepting. And this is something that as a management, we make sure that everyone make a choice with the right set of information, and as well that we inform all the staff when there's changes on the parameter, just to make sure that everyone feels comfortable with the new situation and the capacities or incapacities that we may have.
Thank you very much, both. There is one quick one that I want maybe Natalia to respond to in less than a minute, because we have to close. The one that has just come from Tonui, asking about how I know you mentioned this earlier, but so that's why I'm saying in less than a minute. How do we manage where we have two protagonists like SAF and RSF in terms of movement and access and the work that we do? That's Lisa.
Sorry, can you just reframe the question for me, John?
Is asking, how does MSF manage operations in areas of conflict occupied by true protagonists?
Yeah, very, very difficult question to answer in less than a minute. But yeah, I think we've touched on some of these points. But and as I mentioned before, one of the big challenges that we have is negotiating access. This is a big part of my job, is negotiating with the warring parties to negotiate humanitarian access and to get access into these different spaces. We rely a lot on our core principles, or one of our core principles being neutrality in these cases. And most of the people that I speak to on a daily basis really understand what this principle means, and they understand the humanitarian needs of the people. So we do have very regular contact with the leaders of the warring factions to explain who we are, what we're doing here, the fact that we are neutral, right? We're not taking sides. We're not here to make any judgments about what's happening. What we're here is to respond to the humanitarian needs of the people, regardless of who these people are, where they come from, what the color of their skin is, or any other factors. So this is, I guess, just one of the ways that we manage these things. We also have in place very strict rules about safety and security that all of our staff are expected to follow and comply with. And we put a lot of effort into making sure that all of our staff are following these protocols, and that we're regularly updating them to make sure that they're still relevant, and to make sure that we're doing everything we can to be able to operate in these spaces.
Thank you very much. I've seen the comments from Vincent, Megan, and even Joel. Because of time, unfortunately, we cannot continue. We would have loved to go on and on with this discussion, but you will see it is titled Forgotten Crisis, Episode 1. We are definitely coming back with more information about Sudan, DRC, and even South Sudan, just to tell you to be on the lookout when we make the call. Come in and let us have this discussion. And what we say in MSF is that we will go where no one else is willing to go. We will do our mantra, and that is providing medical services to those who need it the most. And what we are saying is, let everyone else come in and join us, the international community, and even the people, the protagonists, where they are. We are saying all we are asking for is give us the access, allow us to give medical services to those who need it the most. I am reminded that we have our colleagues in the media who have been on call. Please reach out to us if you need any further information. Myself and Mildred, who is also on the call, and even the rest of the team from Nairobi are here. Just reach out to us, and then we will be able to facilitate if you need any interviews and you need to speak further about DRC and Sudan and the work that MSF is doing. Ladies and gentlemen, we have come to the end of this discussion today. As I have said, we look forward to another one. Thank you very much, Natalia and Lisa, for the 1 hour that you have given us to have this discussion with you. The technical team in Nairobi, Johnston, Mikala, Elizabeth, and our leaders in Nairobi, thank you very much for making sure that we have a seamless, smooth process. Until next time, my name is John Riaga, and I have been your moderator. Thank you very much, and see you in our next episode.
Thanks a lot for having us.
Thanks, John. Thank you
Bye,
so much.
bye.